Is everyone ready?
Yep.
Good afternoon, everyone. Welcome to this afternoon's press conference for the 6th of November. I'm going to run through the people we have here today. We've got Lucy Whiteman, our Director of Public Health. We've got Deborah Needham from the Acutes. We've got Elliot Foskett from the Police. We've got Councillor Jonathan Nunn from NBC, Councillor Tom Beattie from Corby Borough Council, Councillor Martin Griffiths from Wellingborough Borough Council, Paul Andrews from NCC Children's Services, Councillor Stephen North from the North, Councillor Richard Auger from the Daventry District, Katie Brown from NCC Adults, Darren Dovey, our Fire Chief, and last but by no means least, Becky Bradshaw from the University of Northampton. Today we're going to do... Sorry, could everyone please mute themselves on entrance? Thank you very much. And we'll use the hands up facility for any questions as and when we get them. We're going to do it slightly differently today. We will start with Lucy with her update on the figures, but we will come then to Deborah Needham from the acute hospitals. We will then have something from Elliot Foskett from the Police, and then Darren Dovey, our Fire Chief, and then we will move it open to other members of the press briefing. So without further wait, I will come to Lucy Whiteman, our Director of Public Health, to give us her update on the figures this week. Thank you, Lucy.
Thank you, Councillor Morris. We're just going to share the slides with you, but as always, this report will be available later on today on the County Council website, along with all of the latest guidance, links to testing availability and any information, and some of our media campaigns should anybody want to access that information. So this report contains data up to the 1st of November. And our key messages really are that obviously we're now in a new set of national restrictions. So for want of a better phrase, it's a second lockdown. But these restrictions obviously are being imposed across the country, and Northamptonshire residents are obviously being asked to follow them to ensure that in 4 weeks' time, if and when we come out of these restrictions, Northamptonshire is in a better place. So again, we've had a week with more than 1,000 positive test results for COVID-19 in Northamptonshire. Cases will continue to accelerate unless we see people utilise this 4-week period to stop the onward chain of infection. I cannot repeat that enough. And one of the really key aspects of the lockdown is our ability to bend that trend and start to reverse the pressure that we're seeing starting to appear in our NHS services. So if we go down a couple of slides to the first set of key statistics, obviously you can go through all of the information about national restrictions and the local measures. But you can see here, the week up to the 1st of November, we recorded a total of 1,039 COVID positive patients in Northamptonshire. That is indeed an increase again on the previous week. However, the one positive aspect it is a slight increase. So I am hoping that this is the very early start of a slowing trend that we can then use the next 4 weeks to reverse. So, you know, it is not a position that we want to be in or to become complacent, but it certainly does show or start to suggest a slowing in events. As I said, we've got an opportunity to maximise that position over the next 4 weeks. If we go on to the next slide, please. So now this is quite a different picture to recent weeks. Yes, absolutely, we've still got that large group in the age 10 to 19-year-olds, but you can see there's a big growth here in the female population, and there is also a big growth in the 40 to 49-year-old population, and again across the working age groups. So again, one of our concerns here is the fact that those older age groups are more vulnerable to potentially more complex symptoms and a more complex disease process. They're more likely to be admitted, and they're more likely to have either long-term implications for their health, or indeed, if they're particularly vulnerable, to die. So it's one of those things that we must understand how this is moving through our age groups, through our generations, and our younger people here have a role to help protect some of our older and more vulnerable in the population. So if we move down. So here we can see that obviously there's an overall growth in the crude numbers from last week for the county. There are a couple of areas that have seen a small drop, and it is a small drop in numbers compared to the previous weeks. But again, in Daventry, East Northamptonshire and Northampton Town, we've seen an increase in cases against last week, 400 cases alone in Northampton. And East Northamptonshire, as I've talked about before, one of our less affected areas historically, 160 cases in the last 7 days. So please do note that this is a county-wide challenge, and despite a small drop in some areas, our overall trend as a county is still upward. If we go on to the next slide. So this compares the rates, as we always do, and we've got a statistically significantly higher rate in East Northamptonshire and Northampton as compared to the average for the county, which is a real concern, real hotspots as far as the numbers are concerned. Our case rate in 2 areas has dropped just below 100 now. This is where we want to see all of our boroughs and districts heading, and this demonstrates the fact that we can do it. What we've got to do is get those people during this 4-week lockdown who have concerns or develop symptoms, get them out to testing, and then obviously back into isolation until they get their test results. And if you do have a positive test result, it's remembering you need to isolate away from the other members of your household as much as is possible, to utilise any shared spaces last, and to obviously step up your cleaning regime, making sure you use just a dilute bleach solution to clean surfaces and touch points. Some of these key and basic hygiene measures will be the only way that you stop that onward chain of infection within your household. So if we go down, we can see that trend just pictorially over the county. We've talked about this before. You can see it is an upward trend. Thankfully, we started to see a couple of other areas, a couple of the areas in Northamptonshire start to plateau a little, but we've still got a long way before we start to see a decline in cases. If we go down just to our position in the education settings, so 33 outbreaks currently in schools and colleges, and obviously these establishments will stay open throughout the 4-week restriction period. Associated with those 33 outbreaks, 188 cases, which obviously is impacting significantly on some of our children's education again. So it's key that obviously this lockdown period is utilised to minimise contact outside of the school environment. And schools will continue to work with our environmental health officers and the schools team within the council to ensure that we mitigate this risk and again start to try and bend this trend of increasing outbreaks in schools as well. Becky's here from the University of Northampton, so she may well want to update us because I know that the figures have changed from here. But we have got 100% of schools open, which is a really positive thing, and a slight increase on last week's pupil attendance, slightly down on last year's position, but still a really positive move forward, and obviously one that we want to be able to maintain. If we just go down to our overall outbreak position, so if we skip a few slides. Again, a challenging picture, 80 currently active outbreaks across the county. People again will know that they are spread across all of our boroughs and districts. Yes, largely in educational settings, but people will have seen that we have got them in hospitals and hospice settings from a point of view of the proactive swabbing that is undertaken. But again, also small outbreaks that we continue to identify in care homes, again with a proactive swabbing process. So trying to make sure that those vulnerable people in those 2 vulnerable settings, we identify COVID early, we get those people isolated, and we break the chain of infection. And obviously that's what this 4-week period is going to enable us to do on a much larger scale, assuming that people will be compliant and that they all play their part. We've got a real opportunity here to bend the trend, protect each other and protect our NHS services. So if I stop there, thank you.
Thank you very much, Lucy. A very good summary as always. I think what's clear is that we all need to work together during this lockdown to make sure that it works and that we come out of the lockdown countrywide in a better position than we currently are in. We are apart at the moment, but we're very much in this together. It's also worth mentioning the support that's in place through the community resilience hubs, districts and boroughs and local community support, including, of course, the very important voluntary sector who have been working extremely hard during this time. And we would ask that if you have other support, please use your other support networks rather than using other forms of support that will be stressed at this time. Also, if you're financially able to, we would ask if you could help support food banks, which are enormously important at this time. So thank you very much. I will now come, thank you, Lucy, for that. I'll now come to Deborah Needham. Welcome from the acute hospitals to give her picture of how she sees this week, this week's figures, or what is going on currently in the hospitals. Welcome, Deborah.
Thank you, Councillor Morris. So at the moment, both our hospitals are operating at a very high occupancy level. We are expecting the numbers of patients with COVID to increase over the next few weeks and then into winter. At present, though, we are continuing with all of our routine elective operations and outpatients, and that means that patients should continue to attend their appointments as planned. Now, if at any time we have to postpone appointments or cancel operations, we will of course contact patients in advance. So the key message there is, if you have an appointment, please do attend for it. We have got a lot of inpatients at the moment, and we do need them to go home as soon as they are fit. So please do collect your patients, your family, and take them home as soon as they are deemed fit to leave the organisation. We obviously would like to ask the public to protect themselves and keep themselves well. Generally, it's important to look after yourself, and if you do become poorly, please seek care as soon as possible from the most appropriate source. That could be your GP, it could be your pharmacy, or an urgent care centre. Or of course, if it's urgent or it's immediately life-threatening, then please do come to A&E. So as far as COVID-19 is concerned, we collectively as a county must do as much as we possibly can to stick to the rules here. The advice and guidance is really important, particularly making sure that you wash your hands frequently, making sure that you are wearing a mask, and making sure that you're maintaining social distance. Reduce contact with other people as much as possible. That's going to reduce the spread of the virus. And make sure that you protect yourself and those around you by having the flu vaccination. I have recently had mine in the last week. It's painless and I've had no side effects either. So that's really good. So just really to remind the public, both hospitals are fully open. We are diagnosing and treating patients for all conditions, not just COVID. Our emergency and urgent care facilities are there for urgent and immediately life-threatening cases only. So please use them wisely and do consider the alternatives, as I've just noted. We've got robust escalation measures in place, and this includes increasing some bed capacity gradually as we go through the winter, and that will be as we need to increase that capacity. We have continued to have 2 pathways in place which are safe, so one for COVID patients and one for non-COVID patients. We've also created COVID safe areas for our planned elective surgery, and that's within both hospitals and also with our partners in the private sector. So really, it's important that everybody sticks to the rules, but please do not hesitate to access us if you need to. We are open. And I'll stop there. I'm happy to take some questions at the end. Thank you.
Thank you very much, Deborah, and thank you for the enormous amount of work that you and your colleagues are no doubt doing in the NHS at the moment, both locally and nationally. And I would underline the message there, which is, you know, we have to protect our NHS and save lives. It's really as simple as that. Thank you, Deborah. I'm going to come to Elliot Foskett now from Northamptonshire Police. Elliot, good afternoon.
Good afternoon, Councillor Morris, and good afternoon, everybody. Superintendent Elliot Foskett from Northants Police. I've just got a couple of, I guess, really brief messages that I'd like to convey today. And first of all, it will be really on behalf of Northamptonshire Police, we're just urging people to follow the rules, follow the legislation. We've said this before, as a police service, we want to work with the communities. We don't want to have to issue tickets. It's not something we would want to have to do, but we won't shy away from doing it. And I think some people will have seen more enforcement activity over the past few weeks as a result of this. So, as I said, it's not something we really want to do, but we will definitely be doing it, and we are doing more and more of it as we go forward. I think it's fair to say we started increasing our enforcement activity as we started to see a rise in positive cases, working with our partners here in the county, and we've now got a new joint enforcement team, which I'll talk about in just a minute, to help deal with it. I think the statistics, which I won't talk about today because I can't, they're going out to MPCC centrally, but you'll see a rise in enforcement activity from Northamptonshire Police. And I think it's fair to say, folks, actually, we've probably been a bit ahead of the curve compared to some of our other forces across the country here, mainly because of the close working that we've had with people in our NHS, in public health, and with our other partners as well. So I guess the message there is we'll continue to engage with communities, we'll continue to work with people, but where other people decide they're going to put people's safety at risk, we'll deal with it and they'll be held accountable for it. Secondly, the message for me is in relation to that, really, what can you do other than follow the rules yourself? If you're concerned that somebody is doing something that is potentially putting others at risk, that's what we're here for. Our job is to help protect people. Our job is to help keep people safe. And as I said, we've got this joint intelligence team that's about to be set up, working with local authorities, working with environmental health, marshals, wardens. It's a great team that's going to be set up specifically to deal with these COVID issues. Alongside of that, for your reassurance, really, we've got dedicated COVID cars on every single day across the county and dedicated resources in our control room to handle it. So if you're concerned, you can report things online to us and we will deal with it that way, or you can call us if it's an emergency. I guess I would just temper that with the fact that clearly we've got other emergencies to deal with too. So just sort of, I guess, manage your expectations, but we are getting out to far more breaches than we have done before. That includes people not wearing face masks. So you'll recall right at the very start of this, we said actually the police really would only get involved in that as a last resort. This is a last resort. We are now in a lockdown. People who continue to not wear face masks out in public when you're supposed to do so in shops and on buses, you can expect that police officers will be around and PCSOs will be around as well. We've been enforcing against things like people not self-isolating when they're told to do so, again, putting other people at risk, people who have returned from abroad and should be quarantining, and others as well. There's been a whole range of these fixed penalties that we've given out. So finally, I guess, I think the main message from me at the end is, I'd urge people to remember why we're doing this. And I know it ties in really with what Deborah's just said and what Lucy's just said. Why are we doing this? Well, if you think back a few months ago, it wasn't that long ago. We were stood outside clapping for our NHS, doing our bit of a nighttime and our key workers. We're here again. None of us wanted to be here again. We want to get out of this as soon as we possibly can for the safety of the people and for our businesses and our local economy too. So we would urge people, please, please, please comply. Where you see people not complying, let us know so that we can deal with that. And again, happy to take questions at the end.
Thank you very much, Elliot. And I think we all absolutely endorse what you're saying there. We are essentially a team in Northamptonshire, including us who are here now, but also all the people of Northamptonshire. And it really is, it is not a situation of them against us. We're all in this together. So I'm going to come now to Darren Dovey, who is our fire chief. Darren, hi.
Hi, Ian, and good afternoon, everybody. So, yeah, just a few simple messages from me, really. And I suppose it's just to reiterate what other colleagues have said. And that effectively is the very, very simple message that, more virus in the county, more positive cases in the county, not only affect those individuals, but also start to affect our ability as services to be able to deliver services back to you as the public. So effectively, protecting yourselves also then helps us to protect you. And particularly important is protecting those who are more vulnerable in the county at the moment. So more virus equals more absence within our own services, which equals a reduced service and therefore reduces our ability to be able to protect you. And it really is, like my colleague said, about the basics. And the facts are that you can have as many rules and as much guidance and as many risk assessments as you want. If people are not following any of that and there is no compliance, they effectively just become pieces of paper that people read. So, you know, we would urge as a fire service everybody to absolutely comply with the government guidance and continue to do those simple things. Wear a mask where you need to, maintain social distancing, wash hands, good hygiene regimes. And I appreciate that everybody's fatigued. Obviously, we're 7-8 months into this, but if we can have a really massive, big effort over the next 4 weeks across the whole of the county, it means that throughout the winter, all of the public sector organisations can continue to do what we want to do, and that's protect the public, both in terms of COVID, but also in terms of all of the other things that we would always, you know, are having to deal with on a day-to-day basis. I mean, at the moment, from a fire perspective, we've got a good 999 response service. You know, we're still carrying out prevention and fire safety activity for those that are most at risk, and we want to continue to do that. So it's just to reiterate, please, a really big effort over the next 4 weeks to help us to continue to help you.
Thank you very much, Darren. Again, we all absolutely agree with everything that you have outlined there. Thank you for your time today. I was going to now open up to questions actually on the basis of those items that we've heard from. I've got one hand up already, which is Laura. Hello, Laura.
Hi, sorry, just muting myself and trying to move away because I'm recording. I'm so sorry, I'm recording this on 2 systems. So, firstly, I just wanted to double check something. The walk-in test centre at the university, is it launching today or Sunday? And then another question I had for someone from the county council, I'm not sure who exactly it would be, who's on, but it would be, it's to do with, there was a press release sent out earlier today regarding Northamptonshire services, Northamptonshire County Council services and what's happening with them. And for Northamptonshire libraries, it mentioned that they would be closed for now, that several services are running still within them, but that reopening would be reassessed after the 2nd of December. But for Northamptonshire Archives and Heritage Service and for the Children's Centre, it said both would be closed until further notice. So what does that mean for those services? And also, I just wondered, and you may have mentioned this already, so apologies if I didn't catch it, but this is to Superintendent Elliot Foskett. Could you say how many fixed penalty notices you've handed out in the last week or to date, whichever figure you have available?
Thank you very much, Laura. And I would say that I know lots of people submitted written questions as well, but I do feel the majority of those have been answered, which is why I'm opening up to the floor with the press now, because I didn't feel we needed to repeat those questions. But thank you for your questions. I think this is a 2-parter. So I think Lucy probably is the first port of call on the testing centre at the university, but Becky may also, Bradshaw may also have something to say on that, and then I'll come to Elliot. But if I start with Lucy, thank you, Lucy.
Hiya, I've actually just tried to get hold of my testing lead. Becky may know we were piloting this week, so dependent on the pilot, I'll confirm which day it goes fully live, unless Becky, you've got an update, which I don't.
So, yes.
Yes, Becky, hi. Well, good afternoon. I nearly said good morning. I don't know where my day's gone. Carry on. Becky.
Good afternoon. Pilot is today, Lucy, and then obviously if all goes well, it will continue from today.
Thank you, Becky. And did you want to say anything else from the university perspective while we have you here, or are you happy just to chip in on the questions as they arrive?
I think the only point I just wanted to make really was just going back to the figures. Obviously, I know Lucy mentioned that our numbers were slightly incorrect there. So we'd actually had 14 positive cases in the week leading up to the 1st of November, which is really positive because it's seeing a decrease in numbers here at the University of Northampton. The vast majority of those were associated with students in the private sector and not in university-owned accommodation. accommodation, so halls of residence. But obviously it doesn't mean that our students can be complacent. We certainly don't want them to be complacent, and all the same messages that everybody else here today has given applies to our students just as it does other members of the Northampton community.
Thank you, Becky. And sorry if I jumped in there to ask you further, but I thought since you were there, it was worth you chipping in with some other points. I'm going to come to Elliot now for the next bit on the police bit, and then I may say something on the services at the County Council, though I'll probably have to come back to you on that in more detail later, to be honest. So I'm going to come to you, Elliot, first.
Yeah, as I said earlier on, we publish these centrally, so we can't release the figures locally for it. Up until about 2 weeks ago, it was 374 fixed penalty notices. They're published every month, so I think the next release of the figures is due out in about 2 weeks' time. And whilst I can't tell you what those figures are at the moment, you can anticipate, it's fair to say, a steep increase in the figures on that, which is reflective of working, as I said earlier on, locally with partners to tackle this and try and get ahead of the curve, to be honest with you. So while I can't give you the figures now, you will anticipate a steep increase in them.
Thank you very much, Elliot, and thank you for your question, Laura. I'm not trying to swerve the question you asked about the services at the County Council, but I would like to go away and come back to you with a fuller answer. Although I would say, of course, it is paramount for everyone at the County Council to keep as many of our services going throughout the pandemic as we have previously done, and will continue to do so as best as possible. So if I may, I'll come back to you on that, Laura. Thank you for your question. I'm going to come to Jack Duggan from the Hello, Jack.
Hiya. Can you hear me all right?
Yes, we can.
All right, brilliant. So I just wanted to ask, obviously the second lockdown came as a bit of a surprise, obviously last week. So just wondering what your sort of reaction was to it, as well as what you feel about the government's communication regarding the new regulations. And considering that there are more exemptions this time around than the first lockdown, does that make enforcement harder? And does it mean they won't be as effective in reducing cases?
Thank you very much. There's a sort of two parts to that as well, Jack, if I may. I think I might bring Jonathan Nunn in, if I may, to just comment on that first part of your question, and then I'll probably bring in Elliot again, and possibly Lucy, but we'll see how we go. So, Jonathan.
I suppose there's a wider part to that, isn't there, about the fairness of the arrangements and so on. It's very difficult, isn't it? There was a strong school of thought that you shouldn't tell people in advance that they've got 2 or 3 days to go out and celebrate before a lockdown. And there was a slow building news agenda that was the worst kept secret in the world, wasn't it, really? Some people say you should actually announce it on the day, and that's that, because there was a certain degree of celebrating that took place before. It is a slightly softer lockdown as well, if that's the right expression. There are some exemptions, aren't there? So it's not what we had before. Just a word on fairness, which I think is partly in a question that's been asked, particularly on businesses. We were only in tier 1, of course, but we were very much on the edge of tier 2 and would have anticipated going into it at any time. So I think we saw more restrictions come before the national sort of lockdown picture was announced. And that's very difficult for everybody, particularly people who are worried about businesses. And, so we now see businesses that have struggled, were closed for some time. Hospitality businesses had the Eat Out to Help Out, which helped them. They're now back to being closed. And I do have a bit of a view that businesses reacted incredibly positively to the regulations. If you go to businesses that were, despite struggling, each had invested thousands of pounds in screens, precautions, removing tables, and so on. My own view is that actually you were relatively safe within that business. A big part of what we saw is what people did when they came out of that business at 10 o'clock at night. Nevertheless, for most of us who are now working from home, the more we go out and mix with people, the more we're going to spread the virus. So quite clearly, I think we had to close those businesses. But if you look at what's been reported in the press, what pictures we've seen on our TV, we haven't seen pictures of people inside restaurants and bars. We've seen pictures of people outside restaurants and bars at 10:30 still drinking and hugging and all the rest of it. So I'm very mindful that this is all about the public, and it goes back to what Darren says. You can do all the risk assessments you like and come up with all of the precautions you like. Actually, it's what we individually do, most particularly when we're outside of the regulated environments. What we still have now within these current setups is we have schools open, of course. We still have buses. We have some mixed good news, which is the businesses around Brackmills are reporting that they're likely to recruit a very significant number of new people over the next week or so, and that's great for jobs. But it means more people getting on buses in the town centre, and bus queues remains an area of concern. Although both ourselves and the police are very active on them, we've also got small convenience retail. They're open because they're essential, but the number of emails and reports that we continue to get from people worried about that, rather than the larger, more formal stores where precautions are more careful, is still an issue. So part of what I'm saying there is to businesses, I'm really sorry for those businesses that invested and now find themselves shut. We have a focus on these areas that are still worrying people: bus queues, corner convenience stores, and so on. Ultimately, though, the virus isn't fair to anybody, and what we've just got to do is we've got to get through it, and let's hope that's what this 4-week lockdown does. Thanks, Ian.
Thank you, Jonathan. Elliot, did you want to comment on the enforcement bit? Because that was also in the question from Jack. Thank you.
Yeah, I don't think it makes the enforcement side of this, actually, if anything, is slightly easier than it's been over the past few months. There are a number of exemptions, but if you look at them, they're pretty much common sense. And it's actually what officers were saying previously in feedback was actually, is somebody attending a place of worship? Are they going to, go with someone who's giving birth? Well, if it's common sense sort of stuff, that's the kind of thing that is in the list of exemptions. They're all there on the government website. It really doesn't make it more difficult for us. I think what the PM said last night actually was pretty clear. The message that came out last night was stay at home, folks, like it was before. Unless you really have to go out, stay at home. Don't go out, don't mix with people, and that way, as Jonathan just said, we'll sort of control that spread of that virus. I mean, I won't comment on whether the legislation is effective in kind of reducing cases. I shall leave that to my medical colleagues and experts to talk about that. But I think I guess the final bit on it would be, I would urge people to just think about what they're about to go and do. Is it likely to reduce the spread of the infection, or could it increase it? And it's as simple as that. If it's about to increase it, do you really need to go do that? And that's as simple as that. So I think, it's as simple. That I don't think I've got anything else I can say on it.
Thank you, Elliot. And I think that is a very clear message for everyone, really. And I think we've been saying it for a while. Just because you can, should you? And I think that's a very key point. Thank you, Elliot. And thank you, Jack, for your question. I've got Stuart now, Stuart Ratcliffe. Hi, Stuart.
Hi, yeah, it's a question for Lucy, really. I was going to ask, I think we've all been surprised about the figures in East Northamptonshire. And I just wondered what you put that down to, and were there any particular hotspots in East Northamptonshire, be it Thrapston or Oundle?
Thank you, Stuart.
Hi, sorry, Stuart. Yes, we are looking into the causes of it. There is one known outbreak, which obviously is associated with some of the cases. But again, it's those typical issues that we've been talking about now for weeks around household transmission within a household. So we are seeing clusters within a household, but again, household transmission. But we do know that outbreaks do play a part in the increase in cases in East Northamptonshire.
Thank you very much, and thank you for your question, Stuart. Did you have a subsequent one, or were you happy to?
No, that was grand. Thank you.
Thanks, Stuart. Thank you very much. Carly Adele from the Chronicle and Echo. Hi, Carly. How are you?
Hi, good, thanks. How are you?
All right, thank you very much.
Good. One for Lucy, really. I think just wanted to ask about the local track and trace, obviously in the back of the funding in the summer. How has it been used and how effective has it been? And then just on the national track and trace, obviously it's faced a lot of criticism over the last few weeks. How is that affecting us locally, and how are your views on the effectiveness of the national track and trace?
Hi, Carly, thank you. I think I made no secret a number of weeks ago that locally we felt the national system was letting us down. Actually, in August, we had the lowest follow-up rate through the national system in the East Midlands, and that clearly wasn't good enough. And at that point, we were still coming out of the tail end of the Green Corps outbreak. So the need for us to understand where these cases were and to identify anybody who might have been put at risk was really key to reducing the spread in Northampton, and indeed was part of that wider strategy that we undertook to get the 3 areas that ended up on the Chief Medical Officer's watch list off of that list and back into a much more positive place. So we were the second area in the East Midlands to actually develop a local contact tracing service after Leicester City, and everybody will know obviously the rationale for them doing that. And when we took over with a local system, so this is, we take on the cases that they haven't managed to follow up within the first 24 hours of the notification, their follow-up rate was 69%. Now combined with our local contact tracing service, we're following up over 83% of the cases locally. We still are finding that there are a number of residents who sadly refuse to engage in this process. We obviously do follow them up with letter. We do try and explain to them when we contact them why this is so important. And so again, I'll just take the opportunity to implore people to participate and to engage. We don't want to know, where you've been or what you've done for any other reason than trying to protect yourself and your loved ones. It is, we don't use that data for anything else. We purely want to be able to warn the people who may have been exposed to the virus, to isolate and to get tested. There is no ulterior motive here. This is about making sure that Northamptonshire is as safe as possible for as long as possible.
Thank you very much, Lucy. Thank you, Carly. Did you have another question, Carly, or are you okay?
No, that's fine. Thank you.
Thank you, Carly. So I've got Kevin Nichols next from the Chronicle and Echo as well. Hi, Kevin.
Hi, good afternoon, Ian. Nice to speak with you all again.
And you.
Thank you. I'd just like to ask Lucy, she's been very helpful the last couple of weeks, giving us some figures on the number of COVID positive patients that are being treated in the hospitals. I know Toby Sanders did mention yesterday a figure of 88 up to Wednesday in the 2 hospitals. I wonder if there's any way you can give us an indication of how many of those are being treated in the ITU department at the moment, just so we get an idea of how the unit's coping.
Thank you for that question, Kevin. It might be that I might bring in Deborah Needham on that one because she's works for the acute or worked with the acute.
Yes, of course. Sorry, I completely overlooked the fact she was there. I'm sorry.
Don't worry, don't worry. I'm sure Lucy will have something to say as well. But, let's get Deborah on the line if she's happy to answer that one. Deborah.
Great, thanks. Hi, Kevin. So we've currently got 87 patients who are COVID positive across both hospitals, and 6 of those are being treated in the intensive care unit.
That's brilliant, thank you.
That was a very, very good, succinct answer there. I don't think Lucy probably needs to add anything to that. In which case, I'm Stuart Radcliffe. Your hand is still up. Did you have another question, Stuart?
Sorry, I forgot to take it down. Apologies.
Don't worry, don't worry. Well, I was going to bring in some of our councillors. So I wanted to bring in Councillor Martin Griffiths because I know he one or two things that locally that are important to him at the moment. Martin.
Thank you, Ian. And I wonder if I can take the opportunity to say a big thank you to the vast majority of the public for their support, but also for the volunteers out there in our communities that have given up their spare time to help and care for others throughout this dreadful pandemic. At a recent one of these briefings, I mentioned the tremendous work in my area of the One Wellingborough teams at both Glamis Hall and the Victoria Centre, but there are examples all over the county of volunteer groups and individuals that I really believe has helped protect, support and reassure the elderly and vulnerable people in our community, and in doing so has undoubtedly saved lives. What I hope we can do is work together, continue to work together to drive these numbers down and cases down further before the start of December, to ensure that we're in the very best place as we return to local tiered arrangements in the build up to Christmas. Thank you, Ian.
Thank you, Martin. Yes, and we definitely all support that viewpoint. Laura Coffey, you wanted to come back in, and again, our apologies for not answering your question on the libraries. I will come back to you on that outside of this meeting, if that's okay, Laura.
Yeah, that's fine. That's okay. My question is to Councillor Martin Griffiths. Last week you said that Northamptonshire people had it in them to help drive down the cases and to avoid going into tier 2. Were you disappointed when you heard the news on Saturday that there would be a national lockdown and you've almost been robbed of that opportunity?
Thank you for that question, Laura. Martin.
Well, I believe that we have turned the corner as far as the figures were concerned, and the reductions that Lucy highlighted earlier shows the tremendous effort that everybody has put in. But I still think there is more to do in the weeks ahead, as I said earlier, to drive those figures down even further and for everybody to work together to protect the whole of our residents in Northamptonshire. The decision was taken out of our hands. As Jonathan said earlier, we would likely have had to go into another tier arrangement, but what we've got to now do is make sure that we do the very best as we come out of this period into any new tiered arrangements.
Thank you very much, Martin. Laura, your hand is still up. Did you have? Did you want to say? Oh no, your hand has gone down. That was very quick. Thank you, Laura. Thank you very much. I'm just looking around. Are there any further questions from the press? I can't see any. In which case, unless somebody else has got any burning issues they want to bring up, I will close the meeting. And I would like to say at the end, it's very important that we work together during this lockdown to make sure that it works and we come out of the lockdown countrywide as well as in the county in a better position. I think Martin and Jonathan have summed that up extremely well. Although we're all apart because we're distancing, we're all very much in this together. Together we can beat this virus, and we certainly can do that here in the county. So I would like to wish you all a very good weekend. Stay safe, stay well. Let's follow the guidance, and together we can beat this virus. Good afternoon. Thank you.
Ian.
Thank you, Ian.
Thanks, Ian. Everyone. Bye.